My role within Cerner is I basically am the clinical oversight of what we call Healthe at Cerner, which is our internal brand for health and wellness. I basically have a couple of very simple mandates. Keep our population as healthy as possible, be innovative while you do it, and don't waste any money. So I must be doing okay. I still have a job as of today. So I'll kind of walk through some of the elements of that. We see at Cerner on our own associate population that healthcare needs to be two separate words. There's health and there's care. Care is the traditional reactive mode that most people are in. You get sick, you go to the doctor, they fix you. But you can be healthy, and it doesn't matter if you have diabetes, heart disease, whatever. You can still be in a state of health. And people move back and forth across the spectrum all the time. In the middle is the manage well. I may have a condition, I need to be managing it well. We always want to push people to the left side of this spectrum. So as we go through this, we look at our population spend and our claims data just like anybody else does. Well, Brain Health looked at it, it was a very minuscule amount, but we know it has a tremendous impact across the broad spectrum of what you both spend on healthcare and what our members, our population experience through it. It causes unnecessary visits to the emergency room. They're not productive. There's a lot of impact that it has. So this was one of the reasons we decided to dive in and tackle brain health as one of our top conditions. The other piece is we knew we needed to rebrand it. We have free fitness centers on our campuses now. What we did is we put, instead of calling it behavioral medicine or stress-related illness, we said, it's brain health. You need to exercise your brain just like your body. You know, they're not two separate things, they're interlinked. In fact, if your brain's healthy, a lot of times your body will be healthy just as proxy to it. It controls everything we do. And that connection most people haven't been able to make. On this slide, what I'm painting the picture of is one of the reasons why it doesn't show up as early as possible, either when you go look at top-level population claims data analysis, or even just within the individual. As Avion said, digitization of behavioral health data from clinical events and that hasn't been there. So you have to get all the way over here to diagnosis before you show up on the radar. And what happens is all this area here, you've been pretty sick for a long time. It's just like diabetes. They say, you know, diabetes can go 8 to 15 years of you having a little bit of elevations of sugar before you actually get tagged with the diagnosis. So early intervention is kind of my message there. And that's where these tools are really neat. So all the new stuff we're hearing about at this conference, as part of my mandate, I get to drive it into our population much earlier as opposed to waiting the typical, you know, I don't know what the number is today, somewhere between 10 and 20 years for most of this science to actually get into practice. So one of the ways that we're coupling this with our overall company's big vision is Cerner, you know, we've been in the EMR business for 34 years. We know that this enterprise level data is siloed, and I don't care which systems you have. And there's a lot of other data for individuals that's relevant to their health and their care for that matter. And the only way to truly get precision medicine, predictive medicine, is you gotta get it to a layer to where you can start combining across the stack. And that's this metadata layer. So all of this data down here is semantically tagged. You know, it's all the interoperability pieces. It needs to be pushed up. And then companies like yourselves, other innovators can build smart agents, other decision pieces that leverage all these disparate pieces of data. That's the powerful thing here. And the fact of the matter is there is an immense amount of this happening. So if I'm down here and it's this physician, I'm nervous as heck because how am I supposed to take care of this? So the work being done is taking this large amount of metadata and giving it to me in a way that I can say, okay, I know how it applies and I know how to fix it, or I know how to intervene. And then presenting it to you as the consumer says, I get it. I know what I'm supposed to do now. That has been missing as we've known. So kind of a process we take is, again, aggregate all of this, get it to the metadata layer. We have a sepsis agent, a predictive algorithm that's running today across these metadata layers. You could be seen in a clinic who's running this EMR. You could go to the pharmacy and get a drug. You can have claims data showing on that, end up in a hospital. All of a sudden, looking across that broad spectrum, this thing says, you know what, they're following a pattern for sepsis. And we know if you don't treat sepsis within the first 6 hours, you die. And we've had multiple saves now as a result of this. So putting it in the context of this, if I'm looking at, brain data saying, okay, they're having negativity bias and they're starting to miss work, and I'm starting to see, things that are in the ER for chest pain, various pieces, all of a sudden it's like, you know what, I need to jump on this person. I know there's more going on here than, just little aches and pains and things, which is what happens today. And a lot of times I don't even know what happened at the other places. So, my message there is there's a lot of information out there that never gets taken into account, and how are you going to really personalize that around the individual as you go through it? So this facilitating member engagement is critical to it, and it actually gets me over to what is personalized medicine. My definition for personalized medicine is you're meeting the person where they are, which means where they are in their condition, their risk, their health, and physically where they are, or virtually. I may be seeing them in the office. I may be interacting with them through smartphones. I have my phone here somewhere. Everybody's got one of these. I can interact here. I may be giving them medication. I may be interacting through a health coach, through the fitness center, through the cafeteria. Meet them where they are. That's what people today expect. They expect it now and where I'm at, convenience. And that's how you get success out of this. So that really facilitates that. You get much better uptake, much better engagement as you go through, and we've seen great successes on our own associate population by doing so. So broadly our approach, I've listed it all out. We feel like we got a pretty good end-to-end process for behavioral or brain health. We have value-based benefit design so they can get their medications for free. We have on-site counselors. We have the online brain health tools. It's great because you get an early screen. I've footnoted it here, but the BRISC, early detection, that's the key. You got 1 or 2 symptoms, we do an online health risk assessment. They can take this at home, at work, wherever they may be, and it identifies them, and then it gets them into the system. As I said, we got our primary care physicians, we have our therapists, and the uptake on the utilization of the online brain resource tools and the BRISC, we're usually running about 200 new people to the site every month. The month we did a proactive blog about it and some pseudo-advertising internally on our social network. We have 400 that month. We have a significant number of people who have logged over basically cumulative 3+ hours on it, so they're using it. And then that gets me to this data. So on the people who are using it, we do pre and post surveys on it. We make sure that they do pre and post testing on it. So those who have been at risk, who fall out of the normal range on this, you can see across these factors here, improving by double-digit numbers. And I mean, to the point where I even questioned the data when I first saw it. It's like, are you serious? We're seeing 61% improvement in anxiety. But our population, I believe it, because it's a young population, they're high-strung, they're programmers, they're overachievers, and they're competitive as all get out. So yes, it is making a difference on the data that we're seeing. Where we are with it is we're taking this data and we're bumping it up against our claims data as we speak. I actually expect a little bump in our total, the behavioral line, but I think the rest will bend down. And I can tell you our overall health benefit spend from last year to this year was flat. So on a per member per year basis, we haven't spent more. So we're doing something right there. Thank you.